Hello and good evening, everyone. I know that tonight we're doing a grad student presentation, so I don't want to take up a lot of time with an introduction, but are there any questions before we get started? Well, oh, yes, Christine?
So apparently I'm still confused about what this week's presentation will be. Um, Next week's assignment brief, the one due October 6th, says that we are presenting during class on a topic regarding our chosen course that we're developing. That is not the presentation we are doing today, correct?
That is the presentation you're doing today.
Today is not October 6th.
Um, no, it's not. I did move,
Okay, I just want to make sure that much I'm clear on.
yes. Um, so I moved a lot of due dates forward because I had been editing some of the content at the beginning of class, and I wanted to just give people extra time. So one thing that may be confusing is the fact that the you have until the beginning of the following week to turn things in. Um, Meaning here we are meeting, and yet you still have until the 6th to turn something in. And if you're not prepared to do the presentation tonight, you can still record it and upload it before October 6th.
But October 6th is our next meeting. That's in 2 weeks.
I don't think
Today's
October 6th is our next meeting. Oh,
I'm
let
sorry,
me,
I know it's definitely, it's not, October 6th, I'm sorry, is a week from this coming Monday.
yeah, it's not our next meeting.
Okay, no, it's not our next week, but it's that same week. That's why I'm confused, because if it
Yes,
was,
that's what I'm saying. It's just, you're probably confused because I was trying to be generous and I moved the due dates forward into the next zone just to give extra time. It's not that the thing you're working on that week is not due that week. I'm just giving you extra time to turn in this week's. Sorry, that is confusing, but
yeah, no, that's confusing because it's like, that's the Monday of the week that we're meeting. So in my head, that
true.
makes
It
sense so
is.
that you have it ahead of time. You can give us whatever feedback and we're presenting. You understand what I mean? So that's why it's like, that to me makes sense. Not that we're handing it in 10 days after. You don't understand what I mean? Like that to me is
Yeah,
very
I
confusing.
I do absolutely get what you mean, but that it's giving you a generous amount of time in case you're running behind, in case you miss class. But I
Okay.
understand that you
Okay.
may think that that doesn't work, or you know, but of course you can turn in whenever you want. I'm not asking you to turn it in. I'm just giving
Okay.
extra time in case you want extra time.
Fantastic. All right. On that note, unless you want something completely off the cuff on the history of psychology, I will be turning it into you before October 6th. So I do apologize
Absolutely.
for that. Okay.
No, I'm sorry for the confusion. Yep, sometimes the best of intentions go awry. All right. Any other questions? All right, so I would like to make this comfortable for folks. So I propose that if you would like to put your name in the chat in whatever order you want to go in. I'm saying this all to everyone at the same time. So whoever wants to go, please put your name in the chat and I will just go on that order.
Uh, Question, Karen. As we're like presenting, do you want it to also like discuss how we incorporated the principles of human learning into this, or do you want us to do that like after? Are we giving this presentation as if we're giving it to our class? I
I
just want to.
just, yeah, just tonight. I mean, obviously, so that's kind of a meta thing. So yeah, tonight I just want the 5 minutes of the actual topic. There is some written stuff that goes with this assignment too, but you don't have to cover that tonight. And that does remind me, because there are a number of people in class and it's supposed to be a 5 minute presentation. If you're like me, what you end up doing is going long. So what I'm going to try to do is when you start, I will set a timer and I wish I had a like a built-in noise or something on. on this Zoom. I suppose I could look for an animation or something. Um, I'll just say the words. I'll just say 1 minute, and then I'll ask you to wrap up. Even if you have to finish mid-sentence, it's all fine. Starting, ending in a class, you have to find a place to stop. So I will say 1 minute, and then I'll say that's time. And I won't give commentary just because there's probably not time for me to make commentary, but maybe we can, as a kind of a compromise, we could do 5 minutes of just chat between sets of presentations. Let's see, 1, 2, 3, 4, 5, 6, 7, 8. We have 8 people right now. Some other people could be joining. So let's do that. Let's do 4 presentations. Then we'll have a chat about anything we went to, things that came up during the presentations, any commentary. That sound good to everyone?
Yeah, Dr. Shackelford, I have a quick question.
Yes.
We're presenting on our course and we're talking about how we applied the actionable principles. Is that correct?
So you're just presenting, the presentation is only on the course. There is a written component that asks you about the, how you applied the learning. And that is not due till October 6th, so you have time to do that in written form if you haven't done it.
I mean, I have a presentation for my course, but I have the course and how the actionable strategies are applied to the course. I don't
Okay,
know.
so just you can save that in the PowerPoint, but if you would please don't present on that tonight, just present on the course. It's okay if it's, just go with the
Oh,
flow. Whatever you have is whatever you have. And yeah, that's the how you're applying it is written. We can talk if we have any extra time about any questions folks have about principles of learning. And you can use other principles of learning other than the few that happen to be in the readings that we had. Those were resources, but you could have read other articles, or you could have anytime in your life read other articles. Of course, in psychology, learning is one of our topics. So, I know we've all read things about learning over the years. It's one of the chapters in a usual intro to psych book, learning. So we talk about that operant conditioning, classical conditioning, all that. Okay, I'm looking for my little timer. Where the heck is that little timer? Oh, on the clock here, and then timers. Okay, so I'm gonna set this on 4 minutes for whoever's going first. It now says 4 hours. Okay, you only have 4 hours to present, everyone. By the way, let's let us say what it is that we're doing here so that we can be clear about this. As I said in the first class, we're peers and you're graduate students, and I know that you're smart and good at what you do. I am not here to be a harsh critic or to call you out on things. I am here to be your support person and to give you input, advice, commentary. Have you thought of this? That sort of thing. So if you're feeling nervous about this is a big evaluation, a harsh evaluation. It is not. This is a support system and a time for practice. So just keep that in mind when you're doing it. No one is going to be, and as I said last time, this is credit, no credit course. So no one's micromanaging some amount of points you're getting, because I'm here because I want to help you think about teaching, help you just have time to work with that information, and just give you time as a graduate student to ask yourself the things that you want to do. And I've probably noticed if you turn in your assignments from before, I have graded all of those, and I just made small comments. They're very straightforward, but what I would invite you to do from the assignments that have already been turned in is to just roll through them and wait, maybe you can't go through them. That's right. I have them and not everyone has them. At some point, we'll revisit this and I'll ask if you want to share them, because people gave lots of examples of specific things they would do in class. And so I would think you'd want to share them so you can look at your peers' stuff and get ideas too. But I'll table that for now because I don't want to interrupt what we're doing for the presentations. I have already hit record and I am looking for the chat. So I see, okay, if you're not ready to go tonight, that's fine. We'll have time to chat about other things. Okay, so I have Jesse, Chelsea, Amanda, Mira, and JP. So if you are ready, whenever you get started, I will hit the start button and do the timer.
Okay, I guess that's my cue, or no? Am I too
That's your cue.
early?
That's your cue.
Okay, there we go. Here we go. So hi everyone, my name is Jessie. I didn't get to meet you. I wasn't here the first class, so I watched the video and you all seem very lovely and it's cool to be in this class. My focus for this psychology course is going to be about true crime media and the victims and survivors of crime and how they kind of experience it. And I'm interweaving psychological concepts throughout. I'm going to share my screen real quick. Hopefully you don't see my desktop because that is definitely a cue into my mental health. All right, let's see. Here we go. Present. Present. How are we looking over there, everybody? Good?
Yep.
Great. So this is true crime media and victims and survivors of crime and the psychological impacts and the paths to you. So we're going to cover a few different zones of some basic introductory psychological concepts, theories, and so what we're going to get into today, we're going to explain how repeated exposure to true crime media affects victims and families. We're also going to describe what re-traumatization is and how it happens. Also another concept called dissociation, as well as another concept called identity disruption. We're also going to apply trauma theory, PTSD, and cognitive appraisal models, as well as introduce narrative therapy as a recovery approach. So we're going to kind of hit mental health impacts. We're going to look at some theory, and then we're going to look at some therapeutic models, all in 5 minutes. So psychological consequences of media exposure. One of the concepts that happens quite frequently to victims and survivors of crime who are the subjects of true crime media is when they have to retell these really events on camera, it can trigger intrusive memories, emotional distress, and really just be an unpleasant experience while you're under lights, camera, and action. A lot of things can also occur during and after, or even before, depending on people's stress level, which is something called dissociation. So that's kind of when you're emotionally numb, you're kind of detached, especially if your story is very overwhelming. Our brain protects us in very interesting ways. And one of those ways, it kind of just like whoop, takes you out of the experience. And that can, like I said, happen before, during, or after filming, or when they re-air, or if something comes up on social media, when stories are told without consent, like so many different scenarios can cause dissociation in victims and survivors of crime. And then, when your story is told in the public sphere, who you are kind of gets compromised. So your identity gets impacted. And so another concept that we can apply to this is identity disruption. And basically, when public narratives shape who a person is, your self-concept is therefore shaped by those public narratives. So it gets very complicated for the people at the center of the story. And, to apply it to just us or people who maybe aren't in the media or have a public presence, just how do you guys experience everyday stress? How does that impact you? And do you really even care what other people think about you? And just like imagine all of those things happening on a very public level. It's intense. And so some theories to back that up is, if we think about an assault victim, right? And let's say they had a Hulu special made about their case and they're watching it again and there's narration, there's images, like sounds, like all of these things can cause someone to remember the event as if it was happening. It can cause emotional distress, flashbacks, all that. And so that's how we kind of now maybe are talking about trauma within true crime. And so if we look at trauma theory, ongoing exposure can just reinforce these memory networks. So it really hinders a healing process for somebody when they're constantly thinking about it, being triggered about it, and reinforcing brain networks. It's complicated. And then if we look at just post-traumatic stress disorder, which is in the DSM-5, again, re-experiencing things can lead to avoidance, can have hyper-arousal. These are all basic psychological concepts of the way in which we respond or the human responds to trauma. And so there's also cognitive appraisal models. So like what's going on in the actual brain and how we perceive
1
loss
minute.
of control. Thank you very much. And
Mhm.
so you know, people, it really impacts how stressful it can feel as well. And so moving on to the approach on how we can maybe heal some of this that's going on is a concept called narrative therapy. And basically that's going to help a victim or survivor reclaim their story from the sensationalized or exploitative media. So basically there's a couple techniques. We can externalize the problem, author personal narratives, highlight resilience. And of course, it's going to restore someone's agency. It's going to integrate trauma. It's going to support identity reconstruction. Telling your story and reclaiming a narrative that is made public and taken out of your control has a lot of power and benefits. So just to recap, you know, today we discussed how true crime exposure can re-traumatize, dissociate, and disrupt one's identity, how trauma theory, PTSD, and appraisal models are involved, and then how narrative therapy offers a pathway to reclaim and control and heal that trauma. And so these are the sources, APA, you know, we're talking Herman, Lazarus, Vanderkolk, White, and Epstein, they're all there. So, and that is a 5-minute presentation on some psychological concepts and how they interact with two crimes.
Thank you, Jesse. I'll give some
Mhm.
applause. Nice, nice. You did it. Very good. And you know, we have, let's see, 1, 2, 3, 4, 5, 6. We have 6. How about every 2 we do a little discussion, uh, feedback, and then we'll go with the other 2 since I think we have time for that. And I invite Chelsea to go.
Okay, so let me just get ready to share my screen.
Get my timer up here.
Okay.
Here we go. Whenever you're ready.
So I'm just going to move this out of my way first so I can actually see. Get this over here. All right. So, hi everyone, I'm Chelsea. I am doing Introduction to Health Psychology. So we'll just jump right in. Very quickly, just an agenda. We're going to look at what health psychology is, how do we define health, look at a brief overview of the biopsychosocial model, go into a quick knowledge check, address some chronic illness and how it applies, address patient benefits, and then end with references. So the APA defines health psychology really as a way to examine how biological, social, and psychological factors influence health and illness. So really what they're doing is using psychological science to promote health, prevent illness, and improve healthcare systems. So we're not really looking more so at a medical model. We're just focused on how are we intervening as psychologists to help alleviate some things that influence illness and also improve functionality throughout their lives. So how we define health really does vary. There's many different definitions, but there's 4 right here, where in the biomedical version, we're really looking at the absence of disease and pain and disability. The World Health Organization really looks at this as a complete state of physical, mental, and social well-being, not merely the absence of disease like biomedical model looks at. Then there's this functional definition of how is an individual able to function and adapt to their environment. Even if they have a chronic condition, they can still be considered healthy, but it would really look at, are they able to perform the daily task in order to function well enough? And then wellness is just this idea of it's a continuous and active process contributing to a more fulfilling and well-rounded life that makes you healthy. So depending on the definition that we're looking at can dictate how we're defining health. And so how does health actually fit into psychology? And that's where we get into the biopsychosocial model. So as you can see, psychology is a prong to this, but there's also a biological piece and a social context that come together with psychology to intersect to address health. And so George Engel in 1977 really did provide this theory, and it was an alternative to the biomedical model. So again, biomedical model focuses on more of the physical illness, and this was a way to bring in different prongs to say, hey, health is more than just the biology sense. But this sociologist Talcott really addressed this idea of the sick role and how a sick person is given certain leniencies because when we're sick, we are kind of expected not to contribute to society. However, as a sick person in our role, we are also expected to find somebody to help us heal. So in a way, the sick role has a sociological impact in what happens to society when we do get sick. So when George Engel really provided some knowledge on biopsychosocial approach, he really was saying, okay, psychologists can come in here and really work on some things such as our attitudes surrounding illness, our personality, and certain factors that might increase certain illnesses or decrease some functionality, how our trauma is also impacting some of our biology and our susceptibilities, and also how does this really look at how we fit in a social context, which often leads to isolation. So as you can see, that APA definition really is hitting on the biological, social, and psychological factors that influence our health. And then if we had time, we'd identify just one biological, psychological, and social factor. But this is kind of what happens when the biopsychosocial model is in flux, right? We lead to chronic illness, and these three individuals have lupus, which is something that is impacted biologically, psychologically, and also socially. So this kind of hits all the prongs, and when our stress levels get out of control, it can lead into chronic illness. So as psychologists, we're looking to impact others' health. And that's where that other part of the APA comes in with their definition. We're looking to improve systems. So this all ties together to benefit the patient as more of a holistic treatment. It impacts their lifestyle. We have better understanding of the illness. It guides our interventions. It empowers patients. And it also provides more effective treatment plans in the process. And those are the references.
All right. Thank you, Chelsea.
Thank you.
Very good. So, reminding us of our context here, we're here to get practice, get feedback, support each other. And our goal is to empower and be positive and also just give advice, right? So I'm going to ask Chelsea and Jesse, how did that feel? Any like feedback on the process in terms of have you either of you taught a psychology class before?
I definitely have not taught a psychology class before. I was more concerned with the 5 minutes, so I felt like I was really rushing through. I feel like if I had my druthers, I definitely would have made it longer, used more examples, incorporated some like active learning into it. But I feel like I just blacked out and came to be honest.
I know that feeling.
I was like, what happened in 1 minute? Oh, geez. But I will say, keeping that in mind, knowing I only had 5 minutes, like you think 5 minutes might be long, but it goes by really quick. And so when I was even putting this presentation together, I was like, well, I don't want to get too deep, but I do want to, try to talk about as many introductory concepts as I can, but like what is realistic here? And like 1 minute per slide, I was knowing that I could talk, girl. So I was like trying to give myself leave room, but even that, it was like tight squeeze.
Yeah.
I felt the same as Jesse. I felt like I was like, okay, like I'm really got to get into this in the biopsychosocial model. There's a lot to go with it. So how do I keep up with the pace? Which was challenging, but I've never taught a psychology class before. I've tutored, but again, that's more like it's a slower pace when you're tutoring someone because they're trying to grasp that concept. So this was definitely new, very new.
Well, I think one thing I definitely experienced when the first time I taught my own social psychology class, I taught a psych lab before, but that was like a surprise happening that happened 2 weeks before. Someone just told me, guess what, you're teaching psych lab. But I prepared and I was doing the teaching of psychology practicum to teach the social psych class. And I think that I thought, oh, I'm going to run out of material. And so I ended up like going slower at the beginning and then faster at the end. I had to really like watch myself for doing that. I took some notes while you were talking, and Jesse, I was thinking that your slides were very nice looking, and so were Chelsea's, but it was in a different way. You know, like Chelsea's were very clean and clear, and I appreciate that. I like that. And uh Jesse, yours were like more artistic, more like interesting, like a publisher does. And of course, both of those topics are interesting. So I was taking notes and I was like, wait a minute, I'm taking notes about the content, not about the teaching stuff. Like just as a little example here. You know, Brian Wilson from the Beach Boys, he passed away recently, and he struggled with mental health issues. And there was a film about his life, and a famous actor portrayed his therapist, and his therapist had I don't know what the criminal terminology was, but his therapist really harmed him. And when Brian Wilson watched the film, he was re-traumatized by the film. It was just this guy really like did a number on him. So I was just thinking about that when you were talking about the re-traumatization. But you know, it's I was also thinking, and we can continue talking as we go here, about when I was teaching undergrads, I was very aware that I'm talking about, you know, psychology, and they're thinking, what are they thinking? Do you know what they're thinking?
When's lunch?
Bye.
Right. Yeah, that's true. They're thinking a lot of stuff, but they're thinking, and what they'll say is this going to be on the test? You know, that's that classic thing. And it can be a struggle between how much do I write on the slide because I want them to have all the information, but I don't want them to be, you know, either writing it down or that it's just too much. In other contexts, I can remember I go to a Unitarian Universalist church, and I was talking in the church, and one of the older ladies said, "You have to slow down." So it's like you have to know your audience. I'm already Midwestern by birth and living in the South, so right there, I'm going to talk faster. But I started to think a lot about speed, that speed is my natural inclination and it's all great. But then how much time, you know, just this is a learning principle too, cognitively, if I'm hearing this for the first time, how what's the pace that will help me understand the speaker? Margaret?
Yeah, Dr. Shackelford, I had a question because I think some of us, I don't know if anyone in the space here today has taught undergraduate level. I have not, to college students. So it made me think, because I already started to kind of do some research on syllabus and content, and it made me think, when we're teaching to college students, sometimes it's like really a lecture. Or I think of like these large lecture halls that I attended, and with a midterm and a final, and like, are you just professing and everyone is just processing and taking notes? I think it's a little bit different than the graduate level classes that are a little more engaging, or Fielding has more like a student-centered learning kind of approach, which has, you know, changed since the traditional ways of lecturing. But it made me think about how to consolidate and teach in a way that you can reach a lot of people, if you are providing a lecture in the large hall, so to speak, and the content. So, and I know that with 5 minutes, there's not a lot of content you can possibly go over, but it just made me think about the style of it.
Yeah, I mean, I want to be upfront right from the beginning. I even mentioned this at the first class. It's an open question whether lecturing is effective. And of course, nothing is unitary. Like what could be effective for me or you might not be effective for two other people in the class. What's reasonable? You know, we have kind of this model that the college professor lectures, and then a lot of teaching science will say, oh, you need to do something else. So I think each of us is always just asking, what do I think my job is and what is effective? There's so much there is so much individual ability to do what you want with your classroom time. And also there are different ways of measurement. So a psychology, I remember when I was teaching undergrads and I had a lot of friends who were in the English department, I would be scanning my Scantrons to grade my tests and they would be rolling their eyes and stuff because they're all, you know, writing essays. And so then we have to think about that too, like what's reasonable in terms of assessment. And there's no, I mean, there's different opinions and um, some things are in teaching of psychology in terms of being assessed for how effective they are. Someone mentioned think, pair, share as a technique on their assignment last week, and you know that's a technique that has been shown to be effective. But yeah, I mean, I think the default is to generally think that professors lecture, and then there's a lot of folks who think, oh wait, we have to also do some other stuff, meaning like active learning. That was the big buzzword. But also the things we talked about effective teachers, like interaction between the students and between the student and faculty. And then there's some classrooms have 500 people in them, and some have, you know, 7. So there's so much going on, really. Eric?
I was just going to say, you're talking about speed and lecturing and stuff like that. Well, I've taught high school students, but say now, for example, I do workshops with assessment development workshops with subject matter experts and at the university level. And so, you know, even at to break down you have to break down sort of concepts that you know, but they may not know for whether it's, you know, high school students, college students, adult learners, more than you think you would have to break them down.
Yeah, there's you know, over the years I've had, you know, tons of feedback and tons of experiences, and um I can remember just various times in the classroom where something I was assuming wasn't happening. Like I remember once I just said, "Oh, I'm just going to play devil's advocate," and my students all looked at me like they had no idea what I was talking about. So I had to go through that, like could they not know? Do you know what that? And so, yeah, of course, you look for expressions like "what." um, that's just some things that you learn to do, and you invite commentary. But you know, this is I'm just talking. This is there's no everyone's got to take their own path. And also we're talking about what the teacher thinks and the student feedback. There's also what your boss, your department chair, or whoever wants you to do, thinks you should be doing, gives you leave to do, you know. So those things are considerations too. Right. Any feedback or questions for the speakers? All right, thank you. I enjoyed those both. And let's see where we are here. We're going to have Amanda and Mira, and then take a pause between those, the next two. So Amanda, I will get my timer ready here.
All right, let me try to share my screen. Slideshow from the beginning. Okay. All right. Hello, everyone. My name is Amanda Birch, and I welcome you to the Survey of Developmental Psychology course. Today, we're going to focus on memory changes in late adulthood. We're going to look at normal age-related memory changes, and then also pathological decline, and then strategies that adults can use to support their memory. So first, I want you to think about it. Think about, have you ever lost your keys or forgotten someone's name? If that's happened to you, I want you to drop a little emoji in the chat or something to just kind of show me if that's happened to you. And that's actually happened to all of us, right? Like we've all probably experienced some little lapses in our memory like that. And many people assume that, you know, memory declines in all adults, and maybe all adults get some form of dementia, but it's really more nuanced than that. And some systems change more so than others. I want you to pay close attention to this slide. It's a really good snapshot that you can use to study from and kind of breaks down the key concepts here. So Siegelman and Ryder from our textbook shared with us that there's different types of memory that are affected differently in late adulthood. So the working memory, if you look at the image with the woman using her phone, it represents working memory, her holding and manipulating information in the moment. This system becomes more limited with age, especially under distraction. And then I want you to look at the episodic memory. That's the picture of the grandfather with his grandchild. It shows us it can be difficult to remember specific events. This type of memory is vulnerable to decline, especially when creating details without cues. And then I want you to look at the semantic memory. The woman studying books is a good visual for that. It shows that the general knowledge and vocabulary, it remains relatively stable or can even expand in older adulthood. And then we have the prospective memory. I want you to look at the calendar. It represents that, remembering to do things in the future. So like attending appointments or taking medication. Older adults often report this as challenging for them. So these examples show us that aging doesn't not just cause global loss of memory. Some systems remain strong and others require extra support. So let's look at some case study examples and see what we think. Imagine an older adult who remembers detailed stories from childhood but struggles with learning how to use their new smartphone. This would be normal aging, right? Stronger semantic memory and autobiographical memory, but weaker working and episodic memory for new information. So it's important to think about how this type of memory would differ from pathological decline. Another example we can look at would be an older woman who forgets the names of close family members, cannot recall recent events, and struggles with basic daily tasks. This would not be normal aging. These characteristics are more indicative of dementia, right? Involving that pathological decline that disrupts daily functioning. So I hate to give some problems without solutions. So I want you guys to think about what are some possible strategies to support our memory as we age. If you have any ideas, just go ahead and drop them in the chat so we can kind of see what we're thinking. If we had a little more time, we could break out into Zoom rooms and kind of discuss it with friends and brainstorm what we think might work. We don't have
It's
that
1 minute.
time. Okay. All right, so let's look at what some of the strategies are. We could stay physically active. Research shows that that helps us increase our memory. It helps, we could do puzzles, we could engage our mental capacity, helps protect us against some of those effects of the cortisol and memory. We can use external supports like calendars, and then we can use training programs and other things. So some key takeaways. I just want you to know that normal aging is a selective decline, not global, where dementia really involves that global decline. There are strategies that can support your memory function as you get older. And understanding all of these things can really help us with that stigma with memory in a late adulthood. And these are my references.
Thank you, Amanda.
Yeah,
Very
thank you.
nice. And I am going to Wordle. I saw that. I am going to go back to the list here. And Mira, I'll invite you to present.
Yes, I'm ready. I just wanted to say sorry to Amanda because it was funny because of our ironic because you were about older people not learning stuff. I tried to put an emoji in the chat, but it kept going up and I kept trying to figure out why it wouldn't go in the chat until I realized I clicked on the wrong thing. So I'm sorry if it disturbed you going up. It was one of those emojis that kept sliding up.
Well,
Through
no,
your
that's
presentation, so I'm sorry that was not intentional.
Oh, you're totally fine. I actually didn't even see the chat. So I was gonna say something about things that I saw, and then I realized my setting wasn't even showing me. So I just faked it till I maked it.
Okay.
you did good. And it's a Mira, that's a thing that happens all the time in real teaching. Some weird thing happens. Someone's mowing the lawn, someone makes a loud noise, what have you. So not that we're showing up just to pop balloons. All right, whenever you're ready, Mira.
Okay. And you see my screen?
Yes.
Okay. So hello everyone, I'm Mira Knowles, and today we're going to look at why research ethics matter so much in psychological research. This is important not just for researchers, but also for you as future professionals, participants of studies, or consumers of research. My goal is to walk you through the core ethical foundation principles of informed consent, consideration with special populations, data practices, deception, and a case example. So the core foundation is the Belmont Report. It's the cornerstone of modern research ethics. It came out in '74. And it emphasizes three key principles. The first one is respect. That means respect for persons, honoring autonomy, ensuring informed consent, these kinds of things. Then we have beneficence. It means maximizing the benefits while minimizing potential harm. And we have justice, which involves fairness in participant selection on who we decide to include or exclude in our data. These principles continue to guide ethical decision-making in psychological studies today. So after the Belmont Report, the American Psychological Association expanded on the Belmont Report and added the following to their general principles. Beneficence and non-maleficence. Basically, trying to look out for the well-being and not to harm subjects or participants. Fidelity and responsibility. It involves having accountability and building trust. Integrity, being honest and transparent. Justice, ensuring fairness in the research practice. And respect for people's rights and dignity. That means protecting their privacy and supporting their self-determination. So one of the most important requirements is the informed consent. Participants must understand the purpose of the study, the risks, the benefits, and they need to know that they have the right to withdrawal at any time. The informed consent should be in a clear, non-technical language so anybody can understand it. It's important that it's voluntary and there is no coercion. Sometimes it's, if there's an incentive, it can also be interpreted as a coercion or favorable treatment or anything like that, or something that may change the data, the outcome. There are exceptions to this informed consent. There is minimal risk deception. However, that requires IRB approval and a thorough debrief at the end.
That's 1 minute.
So again, to go over this, we explain it to the participants. They understand it. It has to be voluntary. They sign, and then they have the right to withdraw. We also have to look out for special populations and power dynamics. Vulnerable populations such as children, prisoners, cognitive impaired individuals require extra safeguard. The APA in their code of ethics even made considerations for research with animals. Power dynamics, you look at students, let's say the participating affects the grade. So people may feel that they're forced to participate. And just as we always want to make sure that we're not unnecessarily burdening participants or unfairly excluding a participant or a group. Data ethics in practice.
Maya or Mira, sorry, I'll stop you there just because I want to give the same amount of time. It's totally fine if you don't
Okay.
make it to the end of the presentation. If you went to school like I did, where there was a bell after each class, sometimes the teacher would be teaching and then the bell would ring right mid-sentence. So that stuff happens. Or something you probably remember from undergraduate is the students getting their book bags and papers and everything ready as you're talking, and there comes a point in which you think, well, they're not going to hear anything else I say at this moment. I remember those days. So we're looking back at Miranda, Amanda. I just merged your names. You're now Miranda. Amanda and Mira's talks, and others, please join in and give input too. I'll ask you the same thing I asked earlier. How was that for you? What did you experience?
For me, I think I was second guessing how challenging to make it. Like I didn't want to make it too easy, but also make it too hard. So I think I erred on the side of too easy, maybe. So content wise, and making it more simple. So I think that was one of the things I was trying to navigate.
So let me ask everyone this. How would you know whether it's at the right level? How do you know as a teacher whether something is hitting at the right level of difficulty?
I guess I would do maybe comprehension checks. I think someone had it in one of their slides that presented earlier, just to kind of see if they're able to answer questions after I have given the information. And if they're getting them all, then I can probably unload a little more.
Yeah, I wrote down a piece of feedback about one thing, you can do different things, of course, different days. One thing you could do is similar to what you just said. What if you set a goal for each lecture that I want to be able to ask them to tell me back some things? Like there's a similar technique. It's basically you might just say, okay, so what is health psychology, or what is wellness, or give them an application problem. Some people do that in every class, like at the end, what is this called? And everyone can look in their notes. I've done that before. Mira?
I was gonna say, you can also look at the body language. Do people look confused, or do they look like they're following? And that can be tricky too, because you may be looking at the student who does comprehend it, but the other 90% may not. So I guess it's important to look around and see how people seem to respond, whether they are still engaged or whether they look confused or disengaged.
Yeah, and for all those who've taught it in any context, you know, it, you have to go with what you're seeing, but you can see so many things. I've had people who I thought were asleep in my class do really well. I've had people who look incredibly engaged all the time struggle on the tests. And there's a mix. Like the incredibly engaged person just might not be the strongest student, and they are engaged, or any number of things could be going on. Let's see, Eric.
I was just going to say, you might have two sections of the same course that you're teaching the same semester, and you're talking about being at the same, or what level do you teach it at? So, you might teach two sections, two completely different ways, depending on, who's in your class and all that. So it might be totally different.
Yeah, and I'm a big believer that you always have a philosophy of teaching, whether you know it or not. And your philosophy of, so here's one philosophy of teaching. I'm going to explain stuff, and it's up to them to get it, right? Um, Another one would be, I'm going to address each person wherever they are and try to teach them. Those are, it's kind of a simplistic way of putting it, but what your philosophy it is will determine how you act. As some people think, you know, the student has some responsibility, and it's not entirely my responsibility. And other people feel differently. So, yeah, I see other hands. Christine?
Like aside from attention checks and other things of that nature, just involving everybody in the conversation after you've spoken, even if you're doing it, let's say you're doing it after every couple of slides, you're presenting philosophers and how they led to the history of psychology, you're discussing whatever else, you're just like, all right, so what do we think of Rene Descartes? What do we think? How did that contribute to what we know of today? Do you agree? Do you disagree? Everybody has an opinion on something, even if you're not entirely sure why. So help develop that, connect some of the dots. And that might also too lead to a better understanding, or, oh, maybe I didn't understand this as well as I thought. Maybe I should pay more attention. Maybe I should ask more questions.
Yeah, Christine, I agree. And we were talking about time on task last time, and I was responding to someone's notes on that. Time on task, it's hard to define because I think what you just said is an important type of thing to do and would result in so much more learning. But then sometimes we have in our mind, like, I need to cover chapter 2 today, so we're going to say it all. And really, I don't know. We all make our decisions as to what the balance is. I guess over the years, I kind of think if I'm conveying something well, that's good. And I know that if I just say everything, that doesn't mean everyone automatically knows everything now for the rest of their life. But they do have some responsibility, and I have some responsibility. So, you know,
The
but
class has to be more than just reading the textbook, though. If all you're going to do is stand up there and read out chapter 2 to them, they can do that on their own. You're there to help them understand and digest the material.
mhm.
So I guess in my eyes, and maybe this is gonna make me a bad teacher, if I don't get all the way through my presentation, that I'm gonna post my slides to later, or they're gonna go and read the chapter later, that's okay, as long as we've had a meaningful discussion or a reflection about the material in class, and I feel like they're understanding it better. Because like I said, you can read something just as well as I can read it to you. But if you have a question about it, or if you think that you have a theory about something, I think I'd rather discuss that a little further, just so I know that you're learning, because part of learning is also synthesizing that information, the stuff that you already know.
Yeah,
It
I
shows a
agree.
better understanding in my eyes.
Yeah, I do for college students, certainly, and certainly for grad students. I know that you can read things fine and digest it. You don't need me for that. But I want to spend time giving examples and talking through things, because I do think when you do that, we all can kind of experience that and go like, oh yeah, okay, now I thought when I read it it was this, but now I'm getting it maybe a little bit different. Yes, Margaret.
Thank you. Yeah, I had a couple thoughts about just checking in for understanding. Aside from in high school, when I was teaching, we did do nows, like a quick check-in to see how much material they've learned from the prior week or the prior weekend or day prior. Also, yeah, so assessments are a really good check. But in our developmental class that we just came from, a few of us, they were talking about the zone of proximation, where what can you learn independently on your own. It's like your comfort zone versus like where you feel like you actually need more help, and then it's like beyond your reach. And I think it's like theoretically finding the blend, like that perfect moment where people are getting it, it's not too easy but they need a little bit more help, versus like something that just seems like you said, like it's glossing over their eyes and they're just completely confused. So I feel like it really is takes a good teacher to kind of discern that. And yeah, it could be nonverbals, it could be actual assessments, there's lots of different ways. But I think check-ins, brief, frequent check-ins are very good just to kind of take a temperature.
And Amanda, you mentioned, is it too easy or too hard? There's so many ways to think about that. I don't know if I told you guys this story, but when I taught intro psych to, I think it was like 250 people, on my evaluations one time, I counted the number, and about half, like a group, let's say 25 people said I went too fast and 25 people said I went too slow. So I was like, oh, good, that's about, I mean, so I did actually think like, well, some people are going to think it's too fast and some people are going to think it's too slow, meaning through the material, not speaking rate. By the way, I worked hard on my speaking rate when I started teaching undergrads because in my enunciation and in clarity, and I was very, very happy when I got good comments on my reviews, because I just realized I have to be aware of that. Like just in talking to people in your life, that's very different from you need to understand my articulation. So that was something that I worked on. I didn't want to mumble and then they don't know what I've said, you know. But yeah, so my point with the too fast, too slow, is it the class itself you're going for? Like who is in the class? Or another way you could look at it is, well, this is developmental psych and this is the information. So I'm going to like mirror the level that's in the book because that has been, you know, approved of by the publisher and the people who wrote it are experts and so on and so forth. And I agree, of course, it feels to me like if your whole class is thinking, what? I don't know, you know, that you know, there's some reason you have to think, okay. But when you teach the same class over and over again, you kind of get used to the idea of, yes, like here we are in intro psych and I'm covering this material. And it seems, you know, the more you do it, the more you think, okay, I've done this before. I've asked test questions, people have answered them, and I'm feeling like, okay, this is going well or poorly. And not jumping ahead to tests, which we don't talk about in here, but that's another thing you can say like, a lot of people missed that, and I don't think it was because they just didn't remember. Maybe the question wasn't the greatest. Maybe I want to revise that. Let's see. Amanda, when you were talking, I just you know, about the dementia and when it's a problem and everything. What I was thinking was, maybe some people in class, now if they were grad students, they might be thinking of themselves. If they were younger, they might be thinking of their parents or grandparents or something, but they might be thinking, uh-oh, like who has dementia? Like, do I have dementia? That sort of thing. Like some topics do make people go, wait a minute. I can remember teaching health psych, and there was a young man in my class who, you know, looked like he pumped iron, you know, looked like he lifted weights. And we were covering like obesity and stuff, and he was like, oh my gosh, my weight is obese on this chart. Like, and hopefully some people are like, well, you know, hopefully they will ask and not just be sitting there. I'm a social psychologist, not a clinician, so the clinicians here will know more about what if you're going over psychological disorders. What if people then have questions about those, if they're thinking, oh, I might be depressed, or oh, you know, I've noticed a friend. And then one thing I put in my comments too on the assignments was people were talking about office hours. One thing I learned when you know, was a beginning teacher was that people come to office hours not only like to ask about their tests or that they missed something, but because they want to talk to you, and sometimes it's very personal. So that's a whole topic of what's your role? What do you feel comfortable with? You know, how do you handle that? We're supposed to be talking about course development, but just putting that out there. Mira, I just wanted to mention, so I have been on the IRB forever, and I do research ethics and stuff. So I was a great student for you because I have those like readings and ideas top of mind all the time, and you're just going through them like the same way I go through them. One thing I'll share with you is my colleague Brian Cutler and we were teaching a research skills seminar on ethics together, and we decided to use an activity called the world's most unethical researcher. And basically we just mentioned everything like they didn't get informed consent, and they, you know, they were trying to bribe people, you know, they were doing all these terrible things. But that's one thing, you know, just an example of an idea that I think people have found engaging. What would be all the things you don't do? Like you don't ask for their consent, or they say, I want to stop the study, and you say no, or something like that. And then you ask people why, and they can refer to the readings and where it says, you must, people should be able to leave without penalty at any time. And of course, that's crucial. All right, very good, very good. Let's see, where are we here? We are going to go to JP and Eric next, and I'll get my timer ready.
All right, let me try to share my screen here. Just a heads up, I'm not gonna go through all my slides because there's stuff on the slide that it's for like the next time. So you guys might be looking at one slide the entire time. I'm gonna cover everything. Okay. Can you guys see that?
Yes.
Let me see if I can. Okay. So I picked Introduction to Psych. It's where we all got our start. At least this is where I got mine. It's when I first fell in love with psychology. I actually took it in high school for AP Psych. But overall, it goes over the foundation for a lot of what we end up doing later on in the field or whatever area we decide to go into, as a lot of you guys saw in the other areas that you guys talked about, whether that be health psychology or memory studies. So an overview of the course itself. This course is an entry-level class for undergraduate students taking a broad overview of science of human behavior and mental health processes. I designed the course to be an introduction to major areas of psychology, the methods, famous psychologists. So we'll get into like the history of psychology. So people you need to know how psychological principles apply to everyday life, because application is everything in this field. For now, it'll serve as just a general education requirement, but it'll be a 15-week course, and we're gonna start off with topics of history of psychology. So just kind of go over the founding fathers like William James, obviously Freud, and then major perspectives. So we'll talk a little bit about behavioral, cognitive, psychodynamic, humanistic, biological, sociocultural, and evolutionary. That kind of goes into the history of psychology because each founding father kind of contributes to each of those areas. And then for that, there will be assignments and discussion boards and everything like that. Week 2 will be about research methods. So we'll talk about experimental versus correlational. We might even talk about qualitative versus quantitative, which I don't know if anyone's done either one of those, but that's a huge topic. Also, ethical considerations, which we heard about earlier from, I think it was Myra. Talking about the ethical considerations involved with research and the importance of reliability and validity in research. Sometimes those get confused or not understood in fully. Biological bases of behavior will be talked about in week 3. So talk about neurons, neurotransmitters, brain structures, nervous system, that frontal lobe that we need developed. And then obviously that's a great time to bring up the Phineas Gage famous case study with how the amygdala works and certain brain functioning, and if the soul versus the heart and personality, where that all develops from. Week 4, we're talking about sensation and perception, sensory processing like vision, hearing, taste, smell, and touch. So aphasia will also be in that week. Perceptual organization, illusions. I'll probably also incorporate some of the IQ testing in there because Waze does kind of work with processing and memory as well. Week 5, we'll talk about consciousness. So sleep cycles, dreams, hypnosis. A lot of people like those types of topics, psychoactive drugs. So even the impact of substances on the brain. So we have like substance-induced psychosis that would also kind of be discussed in that week. Week 6, we'll talk about learning. So classical conditioning, we're talking about the operant conditioning, the salivating dog study, observational learning, the Bobo doll. So some of those famous case studies will also be discussed in that week for learning.
Let's
Memory,
see, 1 minute.
memory will be talked about in week 7, which is encoding, storage, and retrieval, forgetting memory and the memory construction. So we'll also talk about like the reliability of memories. Week 8, cognition and language intelligence. So problem solving, decision making, creativity, intelligence testing. So that's where we'll definitely go deeper into IQ. Some of those studies involved with that. Developmental psychology, stages of development, across the lifespan. Obviously, we talk about Piaget and Erickson and discussion of adulthood. Motivation and emotion, we talked about week 10, theories of motivation, self-determination. Probably going to talk about a little bit about positive psychology in that area as well. Personality, major theories, Freud's theory, trait theory, humanistic theory as well. And then coming up on the end there, we'll talk about psychological disorders. So we'll get into the DSM-5 and what those look like. That's probably where people will start self-diagnosing themselves. And then we'll kind of end with therapy and treatment, social psychology, and then finally health psychology. And at the end, obviously, we'll do exam, presentations, and just overall even games to prepare, having those conversations about what we liked, what we didn't like, what worked, what didn't work, and what's still not being understood. So kind of what we just talked about a little bit ago. So that's my course, Introduction to Psychology, common foundation for everything.
Thank you, JP. Very good. And now we'll have Eric, please.
Okay, let's see. Let me share my screen. Hang on.
Oh.
Okay, and not and okay, so mine is on cognitive behavior therapy, and so the course I would be teaching would be Introduction to Psychology. And depending on how I structured the course, we might do types of therapy at the end, or we might do them earlier before we say covered unit on abnormal psychology, and then maybe have students role play the types of therapy as we're going through that. But yeah, so my topic and also my slides, by the way, are not very not as graphically pretty as some of the other slides. But so cognitive behavioral therapy. So what is cognitive behavior therapy? So it's basically a type of therapy that combines cognitive and behavioral therapy, and it helps clients with their emotions and emotional problems and behavioral problems. So it basically looks at the fact that your thoughts and your behaviors and also your feelings are all intertwined. So the way that the thoughts that you have and the emotions that you have, and then the behaviors that you have as a result of those, all go together. So they're all intertwined and they all work together. So CBT focuses on changing the client's maladaptive or thoughts that are not positive, they're not productive, they're maladaptive thoughts, feelings, and behaviors, and helps them to choose more positive behaviors because of that. So it helps to alter the way people think and therefore and feel, and therefore the way that they act. So you might have a client who goes to a therapist for some type of problem, and so the client, which we can talk about examples, but the therapist is going to help the client sort of understand the problem behavior a little bit better, or delve into what the different thoughts are that go into that are related to the behavior, and the different emotions that are related to the behavior, and then also the behavior itself, and then try to help the therapist would try to help the client come up with different thoughts that are more positive, help them to self-regulate their thoughts a little bit more, self-regulate their emotions more, and then self-regulate their behaviors more, and also maybe to understand what kind of triggers might trigger the maladaptive thoughts and emotions and behaviors, and help them figure out ways to change that. So it's all about thinking and behavior and emotions, and making things more positive. So examples of, and by the way, it's a kind of a time, it could be a time limited therapy, and that, you know, it might last 1 month to 6 months or something like that. So it wouldn't probably be an ongoing permanent type of therapy. It's more time limited because you want to see progress as you go along. And so some examples of maladaptive thoughts: you might have a client that has a thought here: I can't have fun without drinking alcohol. That would be a maladaptive thought. And so you would want the client to change that into, you know, I can have fun without drinking alcohol. And then what emotions go along with that? It might be loneliness or sadness or whatever. What triggers might go along with that kind of if the problem is drinking alcohol, then, you know, the behaviors might be the triggers might be other people who are drinking, or the client is depressed, or whatever. So you look at all that together, and, you know, I can have fun without drinking. And so, you know, maybe avoiding social situations that involve the alcohol where it becomes problematic, or developing hobbies that you can do instead of drinking alcohol. Other maladaptive thoughts: I must do everything perfectly, or I'm a failure, or nobody's ever going to love me. Why would they? You know, there's all sorts of different types of maladaptive, not positive thoughts and emotions and behaviors people have that can be used. The cognitive behavior therapy can be used to help. You know, can be used for things like PTSD. That would be a part of it. It wouldn't be the entire therapy. Anxiety, addiction, etc. But it's a pretty multifaceted type of therapy. And there are my references. And if I was doing an actual class, I would have had you, we would have spent time with you thinking about some of the thoughts and emotions and behaviors that would go, that could be used or delved into in CBT, cognitive behavior therapy. Thank you.
Thank you. So Eric and JP, I'll ask the same questions. How did that go for you? Any input on the experience?
Well, 5 minutes goes fast.
Sure does.
I had a lot more thoughts of, but, you know, you don't really have time for everything in 5 minutes, because really you think 5 minutes, you got to fill 5 minutes, but no, that's fast.
Very fast.
You're
JP, how
still
about you?
sharing your screen, by the way. Hey, I'm
still
seeing 4 of me in that experience.
I wonder what that experience I was having was. I thought I had said I'd drink to have fun, and I was drunk.
Are they to infinity, or just a few when it's like that? Just to,
Yeah, I don't know what was happening there.
okay.
Well, so JP, a little feedback. I like the way you gave a overview of some of the topics that you would be talking about. It did make me think when I was a young nerdy psychology major, I would always just be going, oh yeah, we're going to talk about that. We're going to talk about that. Maybe I think some of the things, some of the words, the students, if they were brand new undergrads, might not know. So that's, I think, something to keep in mind. That's hard to know. It's hard to know whether you're writing a journal article or a book, or whether you're teaching, what can I assume people know? So I was going to suggest some things, but what do folks think? If you're not sure if people know the words you're using, how do you deal with that? Like, Yeah, how do you speak to that when you're teaching? Yeah, Christine?
There are times where I've given presentations like in other classes, and since we're all from different disciplines, everyone has a different skill set. So if there are words that I don't know if people will use, I'll just be like, let's go review some key phrases that you're going to hear a lot tonight. And I'll have a slide up. I'll have like 3 or 4 of the ones that I'm pretty sure at least somebody's going to have a problem with. You can introduce it in any way. Oh, some new vocabulary for this unit, or these are words you're going to hear a lot. Let's discuss them.
Yeah, I like that. These are words you're going to hear a lot. I sometimes I've been, of course, I've given so many different presentations, research presentations, conference presentations, teaching, all the stuff. And sometimes you're in it a little bit and then you think like, they don't know what that means, do they? It's like a sinking thought, like, uh-oh. Sometimes I will, uh, even if maybe I've given like a book definition of something, if I have a sense that maybe there's still some doubt, I don't feel shy about just saying, in fact, today in lab, Jesse could tell you, we were talking about the Bonferroni correction that you use sometimes if you run several linear regressions instead of one multiple regression. And it had been defined, and I think, well, but in my head, I was thinking, somebody here might be thinking, what in the heck is a Bonferroni correction? So I don't think it hurts to just say, let's revisit that. By the way, you divide the 0.05, the p-value, by the number of tests you're running. That's the Bonferroni correction. And why you do it is because you've run a bunch of tests and you might be capitalizing on chance and having type 1 error. So it's a way to be more conservative with your p-value. Look, spontaneous lecture. Amanda?
I was just gonna add something I thought of to kind of see where they're at. I really like how when we go to like fielding sessions and things, we introduce ourselves and then talk about some of our past experiences. So maybe doing something like that, like in the beginning, having them introduce themselves and like, what are some things you already know about psychology or some terms you're familiar with? And then also thinking of like those pre-assessments we get sometimes where, it's kind of just seeing how much we've learned throughout the term. And then we'd be able to look at that and see, okay, like what areas are they already strong in? What areas are they completely clueless or something?
Yeah, what did they come for? Like, oh, they saw a show on serial killers. I don't know what it is. Anything could be an entree into psychology. They're thinking, oh, we're going to learn about therapy or something like that. You remind me, I had a quiz I used to do that they were all basically myths about psychology. One of them was like a schizophrenic has a split personality or something like that, like true or false things, just to get people wondering and kind of just bring up ideas that could be part of the class. Let's see. One thing I had written down is just thinking about all the presentations. This is not a question with one direct answer, but how do you as a teacher decide what is it that I need to put on the slide? Why am I putting it on the slide? And how much? Um, can you, like, when you were preparing this presentation or other presentations, what's the logic behind those decisions? Yes, Christine?
If I'm giving a presentation, the way I figure out like what I'm going to put on the slide is what am I going to write down? If I was listening to this, what am I going to write down? I'm going to write down, like, let's say we're discussing some sort of theory. I'm going to write down the finer points of that theory. I'm not going to write down everything that we're all saying about it. I want to know the breakdown so it's clean and in my notebook and I know what exactly I'm looking at. I try to think of it, like if I'm hearing this for the first time, what do I want to be able to pay attention to the longest? Because this is what I'm going to be writing down. And that slide is going to stay up for the longest amount of time. So I want something and I want it easy to read too. I want it nice and clean. I don't really appreciate when people do presentations and it's just a wall of text. It's like those are your speaker's notes. I'm not supposed to see that.
Yeah, and like I said, that was one of my early conundrums. Like I thought, well, I better put everything on the slide because I might be testing about it. But then, you know, then I started to think, but will they be able to understand clearly? Will the takeaway be clear? And then, you know, today, we could all have the slides, you know, some classes probably have the slides available, you know, at the beginning of class or every year. Do you agree to, you know, send out your slides? Would you do anything differently if you know the students have all the slides?
I'm sorry, was that directed at me or toward the class?
Oh, anyone, yeah, anyone.
Oh, I don't think so. Because if I'm going to be providing with the slides, chances are good you're going to be able to see my speaker's notes anyway. So you're still going to have all of the information from me that you would have received had you been in class. So you're still going to see the notes. If you're in a position where you can listen to the lecture, you're going to hear everything that would have appeared in the speaker's notes anyway. If you're just there to look at the slides, that's still the information I want you to walk away from that lesson with. Whatever is clean and clear on that slide.
You know, I never thought about that. I like the idea of putting speaker's notes in that you then share. And if I were doing that, I guess I would think about, am I writing them for me or am I writing them for everybody? Because if I'm writing them for me, I might just say, tell a story about Descartes' head, you know, or something like that, where it's not self-explanatory, because they cut off Descartes' head after he died, and that is somewhat humorous because he worked on the mind-body problem. They couldn't fit it. He was tall. They couldn't fit him in the casket. But how you write it for you, and so of course they lapped off his head. So how you write it for you is different, of course, than how you might write it if it's basically like a book. Like I am going to tell the story about Descartes' head, and I might say, I don't know, they cut off Descartes' head after he died, and they couldn't fit it in the guy. I might put more, or I might just put something that I thought made sense to people who are reading my notes. But these are all questions. It all to me goes back to what am I going to, what am I sharing this for? Like, so undergrads, I would often think I am sharing this, of course, to teach them the information, but because I'm trying to prepare them for the test. And another thing I might be thinking is, you know, social psychology, my discipline, is an area on the GRE. So as a psychology professor, I might be thinking, okay, I know what the areas are on the GRE. In fact, where I taught, we designed the whole curriculum around the areas on the psychology GRE. So the idea would be, okay, they're going to have to know about cognitive dissonance, or they're going to have to know about persuasion or things like that. And so I've also got like the long game involved, like these are important ideas and I want to make sure I spend more time on them. Like I say, you could have different, like, I also like to teach about cognitive dissonance because even in my graduate social psych class, because I think it is so common and so widely applicable. You know, it could be applicable to clinicians, could be applicable to just us daily life. So yeah, those are some of the ways I make those decisions. So I see we have just about 5 minutes left, and I really want to thank you for preparing those presentations. I think they were great, and you can also see how everyone has a different personality and style and the way they go about it, and hopefully seeing other people, you know, piqued your interest and got you thinking about all the things you might do. I honestly also was thinking just like it's one of those things. Where when you get in front of a class, then all kinds of other stuff happens, like who is sleeping, who is late, who asks like weird questions, you know, when you're trying to say, it's like you might, Eric, you were talking about cognitive behavioral therapy. There could be some quirky person who's like, how's this different from this kind of therapy? Or, you know, and then when you first start teaching, it might throw you off like, whoa, I didn't know anyone was going to ask that. Now what, you know?
Dr. Shackelford, I think Susanna and I are still available to present tonight, but I don't know if anybody has to jump off. I know that we're close to.
Oh, I'm sorry.
9:30.
Did you say that you?
Yeah, and Susanna in the chat also put she's
Okay.
available.
Well, yeah, and if you do have to leave, I can of course stay. So yes, sorry, let me finish my thought here, just in case
Sure.
anyone, not that thought, but in case anyone is watching this recording for the future, I wanted to say, if you weren't here and you need to give your presentation, you want to take a video, time yourself, and upload that. Let's see, there was something about that I wanted to make sure I've said. This is a rather unique meeting in that the students are doing presentations, but basically I've had questions about what you do if you're not at the class. Unlike this time when obviously you're giving a presentation, usually it's just, I need to know that you watched the class, and hopefully if you have something you wanted to contribute, you also can do that when you post something. If you have problems, don't understand how to upload a video, you can ask me, or find a teenager. I always ask my children, like, "Hi." A lot of times, if you wanted to do a written thing instead of a video, that would be fine. But obviously, in this case, it's a presentation, so you need to do the presentation part. Before we go on with the other presentations, is there anything else you want to ask before we move forward? All right, very good. All right, so let's see. We have Margaret and who else is going next?
And me, Susanna.
Susanna, okay. Who would like to go first?
I'm happy to go.
Okay, very good.
Let me see. Right. Let me see if I can get this in a slideshow. Okay. All right. So yeah, so my course that I'm planning to teach undergrad students will be abnormal psychology. It actually was one of the courses that I was also very interested. I think it was Eric or another individual who's talking about intro to psych. It really sparked my interest in psychology when I took this course undergrad. And what we'll be focusing on today is a lesson about the DSM-5 text revision. So this DSM-5 is a tool to help clinicians communicate with one language. And we're going to learn more about understanding various mental disorders and diagnostic criteria. And just a question, and you can pop it in the chat and we can maybe look at it at the end of this presentation, but which diagnoses have you heard about before? It could be anything and everything. So please feel free to pop that in the chat. So what is the DSM-5? It's defined as the Diagnostic and Statistical Manual of Mental Disorders and was published by the American Psychiatric Association in 2013. It's used by, again, clinicians for diagnosing and classifying mental disorders, and it provides standardized criteria for various diagnoses. So some key changes that have been made to the DSM-5 is that they've updated language. What you'll see in the literature is that we're always trying to reduce stigma around various types of disorders. For example, substance use disorder versus substance abuse. We don't use that term anymore, substance abuse. Some new diagnoses have also been added, such as prolonged grief disorder. So if you're grieving a loss of a loved one for a certain criteria of a certain amount of weeks and months, again, there's a new diagnosis for that. It also aligns with the ICD-11, which is another classification system that's used worldwide. And if you check the back of your DSM, you'll see an area for future research or future research considerations. And also the DSM-5 has added a new thing, which is improving their cultural considerations and inclusion. So sometimes they'll talk about not just prevalence and numbers and figures, but they'll talk about how this relates to certain cultural populations. Again, with the lesson next week, we're going to go over and review the use of the DSM, the history, some guidelines. We'll review each section one by one. So this is what's to come. And just another additional note that the emerging measures include, so the DSM now includes specifiers and dimensional risk levels. So you could have depression that's mild, moderate, severe. They can specify it with certain terms. And that's really getting into the nitty gritty, but I just wanted to bring that to your attention. The foundation, so why are we studying abnormal psych? It's a foundation for diagnosis, for treatment planning. It has a lot to do with how we communicate with our literature review in the research. It facilitates communication across multidisciplinary teams. It encourages consistency, reliability, that we're all speaking the same language, and it's a vital tool in understanding and addressing abnormal behavior in clinical settings. And we'll talk again next week about when does something become a disorder. It has to interfere across various settings, and it has to be persistent. And we'll talk about that's a very key component. And again, we also are using the DSM-5 so we can better inform treatment decisions. For example, whether we're using medication, psychotherapy, or a combination. So thank you so much. I left my office hours here, which is at 3 o'clock. So if you have any questions, please reach me there and I will check the chat.
Very nice. You finished up just as my little alarm was going off.
Very good. Oh, I see, Eric. Thank you. ADHD, borderline personality, Chelsea. Good. Binge eating. Yes, I've studied that too. Thank you so much.
Thank you. And Susanna.
Hi. Okay, so I wanted to do, I wanted to choose introduction to psychology, but I also wanted to do abnormal psychology. But then can you hear me okay?
Yes.
Okay. But then I thought, let's make this challenging, and I chose research methods. It was a hard class for me in my undergraduate program. But even in my master's degree, research methods, and even now is still any type of course that involves statistics for me is a little hard. So I don't know if I chose well, but it is definitely a challenge. I did read your feedback on the first assignment. So I put this together. Let me share my screen. And I've always used PowerPoint. I use Canva for this, so I'm still very new with that. And let's see. Okay, can you only see the PowerPoint, the presentation PowerPoint, not my notes?
Yes, I see just the slide.
Okay. So today we are going to talk about, teach you what the difference is between independent variable versus dependent variable. And by the end, you'll be able to identify what's being changed in a study, and what is being measured. So the independent variable is what the researcher manipulates, the cause, and the dependent variable is what the researcher is measuring, the effect. Notice how short parallel definitions help us hold this working memory. This is an example of chunking. Now, let's pause and reflect when you read a psychology article. Can you quickly spot what's being changed and what's being measured? This reflection is an example of metacognition, thinking about your own thinking, and it helps strengthen long-term understanding. So let's make it real. Does coffee improve test performance? If we tested this scientifically, the IV would be coffee intake and the DV would be the exam scores. Here's that same example in a simple diagram. So coffee consumption is the IV exam, the IV, and the exam is the exam performance is the DV. So cause and effect. Now let's look at example 2, sleep and memory. So we wanted to know whether sleep improves memory. That would be the IV and the IV hours of sleep. And the DV is the number of words remembered. So now let's test your understanding. If we tested whether music affects mood, what's the IV and what is the DV? Take about 30 seconds to think or discuss this with a partner. Can anyone tell me what the IV would be in this case? Okay. So the independent variable, the IV, is the type or presence of music. So that is what we're changing. And the DV is the mood, what is being measured. So again, the IV is what is manipulated and the DV is what is measured. Thank you.
Thank you.
So when I was doing this, oops, am I no longer sharing?
We see your thank you screen.
So when I was doing this, I was putting together the example, the presentation, but I was also linking the readings. But as I was reading it right now from my notes, I realized none of you did that. You guys just, pretended that you were teaching the class.
Right. Yeah, and I understand that several or a number of people did think that since I didn't write these assignments, I have read them over and over and over again, and I believe the assignment says just do the presentation. But again, this is we're here for practical reasons, right? So we're here for practice and to get feedback. So I'm not so concerned about the nitty gritty. I think you all could see that 5 minutes goes by so quickly that you can't believe how fast it'll go by. And of course, in the classroom, things are happening. People are coming in, noises, there's just people with questions, just all kinds of things are going on. Oh, if you don't mind, I'm going to go back to something from the previous assignment. So when you go into a live classroom and you're setting up, people will often come up to you and ask many questions and engage you in conversation. And I've always found this very distracting, but they don't, the student may not understand you're trying to figure out where your dongle is and you're trying to set everything up, and that takes some attention. Talk about learning principles, right? And then they're like, hey, we talked about something last week, and then you're like, okay. And then yeah, I'm very like straight, like one focus of attention. Or someone will say like, I'm gonna miss the test, or something like that. And of course, it's just a point of view thing. Like they know I've got to tell her I'm gonna miss the test, and you're thinking I gotta get this thing, and there's a video, and I'm not sure if it's gonna play, or things like that. So, um, I think that in general, the time to ask your teacher questions is not like as they're getting set up, but the teacher may be able to stay and answer questions afterwards. Some people get there very early and they have plenty of time, or they like to talk to people before class. So it's not one size fits all, but also sometimes you're on a campus and you have to leave that room, because somebody else is coming in to set up, or talk about distractions. Sometimes you're teaching in a room and then the people for the next thing come and they're opening the door, and peeking in and it's like, okay, what's happening there? So there's a lot of things that occur when you're doing these different things. I have a question here. I've heard a slide per minute. So yeah, it depends, right? So what would that depend on? Like if you're preparing for yourself, how would you make that judgment?
Somebody gave me this advice when I was presenting for my dissertation. They were like, you need to make sure, like, if you are going to present 45 minutes, that you don't have 70 slides, you have like 45, or you have somewhere in that vicinity. And it helped me and she had like rules about how many things on each slide, so that it's not
Mhm.
so it's manageable, it's digestible, it doesn't overwhelm the audience, it doesn't underwhelm by having like one thing. Or sometimes you do that for like shock value, or you want to like ask a question and then or you want some kind of transition. So there's an art to it, but I found that very pragmatic and practical advice.
Yeah, and do you remember how many things per slide or?
I think I just recall it took me about a minute for each slide.
Mm-hmm.
And I
Yeah.
had probably at least like maybe like 5 bullet points to go through.
Yeah, and presentations, the audience, teaching, the audience varies. The reason people are there varies. Sometimes people are in a abnormal psych class because they're just fascinated by that, or because they plan to become a clinician. And of course, you're going to have various people. Um, you know, I feel like we've all seen a lot of presentations. I feel like there is something of a norm, like you say, of not just a complete text dump, but enough. But sometimes I vary that up myself because I'm thinking I'm going to do a group activity. So I want to just say form two groups, and I'm just going to say like the most elementary thing about them so that is super, super clear. So maybe I'll go light on text for some reason like that. Or maybe I'm animating and I want to tell myself to remember, I'm going to ask a question, but don't click forward because the answer is going to be on the slide. Or what if you forget to animate the slide and then you put the answer up with the question? I mean, all this stuff, of course, happens. About the deliverables, I can go to the Moodle real quick here. You go to the class. Okay, so we did the section 1, learning project 2, due October 6th. Choose a topic and prepare a 5-minute class presentation on the topic. This is a lecture you would develop, you would deliver to the class you're developing, so it should be taught at the undergraduate level. The lecture must demonstrate, your understanding of the principles of human learning. Aha, I can see, like I said, I didn't write this, but I can see where that could mean to you inherent in what you're doing. Like, let's pause and do this activity. That's how I read it. But it could also mean I'm going to state what principles of learning. So, like I say, this is, we're just trying to learn how to teach. So either of those is fine. And now that I read that, I realize it is open to those interpretation. But the written thing I was referring to is prepare and submit 2 documents, the visual presentation. So you could submit your PowerPoint, and you've done it here. If you are listening to this later, you record your PowerPoint, but you can also submit the PowerPoint itself. And then 2 is the written thing I was referring to, a written document describing the sources of the content you're presenting and explaining how you incorporated the principles. So just know, I mean, for this to be brief, it's enough, the people who already did it in their PowerPoint, that is enough for me to understand how you incorporated those different principles. I'm not asking you to write a book, just noting. It's really noting for yourself, okay, this is why I asked people to get into groups, or this is why I paused to ask, now what was that thing I taught before? Do you remember what that was? Or, and yeah, a lot of you had your reference section in the PowerPoint. Any other questions? And I know that we've run over time. Thanks for those of us who've been able to stay on a little longer. And I really appreciated that. And I hope it was a good experience for you. And I will see you next time. Just remember, I'm on vacation from tomorrow to that about 10 days from now, the Monday that follows that. If you have burning questions, I'll probably check my email in the middle at some point.
Thank you. Enjoy your vacation.
Thank you. I will
Good night,
see everybody
everyone.
after.
Thank you.
Bye.
Thank you. Good night.
Good night.